Welcome everyone to today's webinar on AI and healthcare, hosted by Humane AI and IEEE Maine. I'm Julia Upton, aka JTU, an associate professor of mathematics at Husson University, a certified AI expert, and a certified AI developer. And I'm honored to be your moderator for today's discussion. We're witnessing nothing less but a revolution in medicine, driven by artificial intelligence that makes healthcare faster, smarter, and more personalized than ever before. AI-powered imaging detects breast cancer years earlier than human radiologists. AI predicts kidney failure 48 hours in advance. AI outperforms doctors in lung cancer detection. In surgery, even in surgery, AI-driven robotics, enhancing precision, reducing complications, improving recovery times. AI has been instrumental in discovering of a drug, halicin, an antibiotic capable of killing drug-resistant bacteria, and AI is accelerating personalized treatments, which are key for cancer and rare diseases. AI isn't just another high-tech tool. It's a transformative force that's reshaping industries, redefining innovation, and revolutionizing healthcare through breakthroughs in diagnostics, treatment, and patient care. AI in patient care and healthcare education is the focus for today. Our guest today is Ghada Konsowa, Simulation Education Center Director at Husson University, with over 10 years of experience in healthcare simulation. She previously held leadership roles at the University of South Florida and Douglas College in Vancouver, Canada. Holding an MBA and a bachelor's in medicine and surgery, she has expertise in healthcare education and simulation training, and is currently pursuing a PhD in healthcare education while actively contributing to professional organizations in healthcare simulation. This promises to be an exciting session. I know many of you are going to have questions as we dive deeper into the topic. As we go through the session, I encourage you to please type in your questions as they arise. Don't wait until the end. Just type them in straight into that Q&A box, and we will make sure to address them at the end. Again, thank you everybody for joining us. Let's dive right in. Ghada, the floor is yours.
Thank you so much for this great introduction. Thank you very much. Thanks you all for attending today. I will start right in sharing my presentation. Okay, so today we are going to talk about AI and how AI is affecting the healthcare sector. But before we go in, we have to have an idea what's happening in this healthcare sector. Sorry, technical issue. Here we go. So our agenda today, I'm going to talk about the healthcare initiatives, then simulation initiatives, and try to link them both with the AI in simulation practice and what did AI add to the practice. And then we will end it with the Husson AI practice to share our experience. The healthcare initiative, I want to talk about crossing the quality chasm, which is a huge research has been done in 1999 and it was published in 2020. Participants of this research was the national academies as the Academy of Science, Academy of Engineering, Institute of Medicine, and National Research Council, as long as a Committee of Quality of Healthcare in America, which was a huge committee. If I just listed how many members and how many institutions were in this committee, I would use pages. So this research was done in order to really know the quality of healthcare and if there is a gap or not. They concluded, or they talked about that to make an urgent call, this is their outcome, to make an urgent call to close the quality gap. Sorry. I did something. I can't see my presentation. I'm sorry. Okay. So to make an urgent call for fundamental change to close the quality gap, which recommends a sweeping redesign of the American healthcare system and provides overarching principles for specific direction for everybody in healthcare, policymakers, healthcare leaders, clinicians, regulators, purchasers, and others. The committee offered 4 key points. A set of performance expectations for the 21st century healthcare system, a set of 10 new rules to guide patient-clinician relationships, and a suggested organizing framework to better align the incentives inherited in payment and accountability with the improvement in quality. Key steps, and remember this one, please, is to promote evidence-based practice and strengthen clinical information system. This research has been done, started in the States, but it went, and in other countries, they use the same framework in order to assess their healthcare system. The committees, they came with 6 aims for improvement, and they worked hard on these 6 aims since then. First aim is safety, and they define safety that patients should not be harmed by the care that is intended to help them, nor should the harm come to those who work in healthcare. Effectiveness. Effectiveness refers to the care that is based on the use of systematically acquired evidence to determine whether an intervention, such as preventative services, diagnostic tests, or therapy, produces better outcome than alternatives, including the alternative of doing nothing. So evidence-based practice required that those who gives care consistently avoid ineffective care and overuse of ineffective care that is more likely to harm than to help the patient. The next point they came, or the aim that they came to, is patient-centeredness. And for me, patient-centeredness is a philosophy more than an aim, because it is a holistic care of the patient. And the aim focuses on the patient's experience of illness and health care on a system that work or fail to work to meet individual patient needs. Patient-centered encompasses qualities of compassion, empathy, and the responsiveness to the need, value, and expressed preference of the individual patient. Gattus et al. Have identified and gave us some direction and dimension of patient-centered care. And he said that respect for patient values, preference, and expressed needs, as well as coordination and integration of care. Moreover, information, communication, and education of the patient, physical comfort, emotional support, relieving fear and anxiety, involvement of family and friends. So as you see here, patient-centeredness, which is like the policy or the strategy of healthcare system since then, is everything. It's not only the illness, and it's not only taking care of how to treat a certain diseases, it's how to take care of this human being. Timelines is an important characteristic of any service, and we all agree on this. When we go, if anybody, God forbid, have a surgery, to have a surgery within 10 days or within a week is totally different than waiting list for a year or a year and a half. Efficiency in an efficient healthcare system, resources are used to get best value for the money spent and avoid waste. And this strategy or this aim, again, healthcare systems has been adopting it for a long time. Equity, the aim of equity is to secure these benefits for all people in the United States on a population level and on an individual level as well. After all this, and they put all the aims together, they discovered some challenges. And again, I would like to share these challenges because there are some pieces that it's related to our topic today. So one of the challenges they have is redesigning care process. They found it's hard. Making effective use of information technologies. And we'll see the jump in this point specifically later on. Managing clinical knowledge and skills. Developing effective teams. Coordinating care across patient conditions, services, and setting over time. Incorporating performance and outcome measurements for improvement and accountability. After all these challenges, they said, okay, we have the 6 aims, but in order to achieve the 6 aims, there are more skills required for the health professionals to attain. And these are the report identified affecting healthcare delivery, including shift from acute to chronic, the need to manage continuity expanding, evidence-based and technological innovation. More clinical practice occurs in teams, complex delivery arrangements, and patient-clinician relationship change. And again, remember this one, the need to balance cost, quality, and access to healthcare, pressure clinical education programs, particularly giving the public dollars spent on them. Also, the report identified several healthcare delivery I said this one. So I mean here, this point is important. We'll remember it for later discussion. Also, use variety of approaches to deliver care, including the provision of care without face-to-face visits. And here, COVID have jumped this point when COVID hit, because there was reluctancy in using digital and using technology in this field because of the new technology some people didn't feel comfortable using. But once COVID hit, this aim or this skill was expanded hugely. Synthesize the evidence-based and communicate it to patients. Combine the evidence-based knowledge about population outcome, the patient preference to tailor care for an individual patient. Communicate with patient in a shared and fully open manner to support their decision-making and self-management, and including the potential for access to the information contained in their medical records. This is all the story of how the health initiatives came in place and how all the healthcare system started thinking of the gaps and came out for solutions to work on long-term in order to achieve or to close the gap. Now I'm going to tackle something different and we'll link them later on, which is the simulation initiative. So what is simulation? Going back to history. So historically, beginning with the antiquity, when models of human patients were built in clay and stone to demonstrate clinical features of diseases and their effects on humans. Such simulations were presented across different culture and even enable male physicians to diagnose women in societies where social laws of modesty were used to forbid exposure to body parts. And this picture here is the stone. This is something historical in simulation, and they keep it somewhere. I'm not sure where exactly, but this is the stone clay simulator. In the 18th century in France, Angélique de Courtet in 1712 was born in 1712 and she died in 1794, used a cloth birthing simulator to teach techniques to midwives and surgeons. And this is again her simulator. Currently, by the end of 2023, a vendor or a company called Gomard came out with HAL, the first AI high fidelity mannequin. And from the very beginning, where we used clay and stone, to the day we're using now AI mannequin, there was a very long history of all sorts of mannequins and all sorts of advancement, starting with simulator N, and Harvey, which is a cardiovascular simulator for cardiologists, and all the anesthesiologists that use different simulation for anesthesiology. So it was a very long history coming from a very long time, and the idea was there and it was implemented in different ways. What is the definition of simulation in healthcare? It is an initiative that refers to the practice of using simulated scenarios to train healthcare professionals in a controlled environment, allowing them to practice complex medical situations, developing critical decision-making skills, and improve patient safety without risking actual patients. Often used as a key component in quality improvement projects and training programs across various healthcare disciplines. So this is simply simulation, creating all this atmosphere for healthcare professionals to perfect their skills and to challenge themselves and to decide and to work in groups, making sure by the end that the patient is safe and they are safe as well. So the purpose is to replicate simply real life scenarios to provide safe space to learning, practice skills, assessing competencies in various situations, including emergencies, rare condition, and complex procedure. Technique, simulation, don't understand me wrong, it's not only a mannequin. There is a philosophy behind it. And simulation is a branch from experiential learning, as we all might know, which is active engagement of students in learning through doing and reflecting on those activities. And this experience and reflection enable them to apply theoretical and abstract concepts to practical context. So this is the switch. This is the educational piece. This is how they learn. So we're talking about mannequins and a space, but at the same time, there is a technique that has to be perfect in order to have the proper learning experience for the students. We are all simulation centers, people who are working in simulation. We follow the SSH, which is Simulation Society for Healthcare, which regulates, makes all the guidelines, give us directions, best practices, researchers. So we all follow the SSH. Is there a benefit from simulation? Yes, there is a lot of benefit. To mention a few, improved patient safety by allowing practitioners to practice in a low-risk environment. Simulation can help identify and address potential errors before they occur in real patient care. Enhanced clinical skills, and this is very important. This is one of the important points that relates to the 6 aims in the healthcare. Repetition through simulation allows for better mastery of technical skills like IV insertion, medication administration, and advanced life support procedures. Also, teamwork development. Simulation can be used to train healthcare teams on communication, collaboration, and leadership during critical situations. Effective assessment provides a standardized way to assess individual and teams' performance in different scenarios. So definitely simulation brings everybody on board and enhances and sharpens the skills before they are dealing with a real patient. Types of simulation, we have multiple types of simulation, and we can do simulation in different ways. We have standardized patients, which simply they are actors trained to portray specific patient conditions, allowing for practice of the patient interviews and communication. Mannequins, we have different range of mannequins, starting with the low fidelity mannequins to high fidelity mannequins, which simulate various psychological responses to different interventions. And we have now the high fidelity AI mannequins. Virtual reality is another way of practicing simulation, which is a computer-generated environment that allows for immersive practice in complex scenarios. Task trainers are devices designed to practice specific skills like suturing or airway management. So they are very specific to skill by skill. In situ simulation, which is another one, which is replicating the real clinical setting within a healthcare facility to assess team dynamics and workflow. So what are the initiatives, or what's the simulation used in healthcare initiatives? Now we're going to see, okay, we have the healthcare aims, and we now know the simulation initiatives. So if we put them together, we will see that medical education, integrating simulation into training programs for medical students, nurses, and others, healthcare professionals. Quality improvement projects, we can use simulation to identify areas to improve within the healthcare system and test interventions to mitigate risks. Team training, best way to facilitating interdisciplinary team training to enhance communication and coordination during complex patient situations. Competency assessment, evaluating healthcare provider skills and knowledge through simulation-based scenarios. And since here I mentioned competency, I have to mention that in the research, the big research that they did, competencies and certifications and accreditation, all these things were hit hard because they said, okay, if we want really to regulate and to make sure that everyone is competent, we have to have standards for everything we are going to do. So competencies came very important. And nowadays, if anyone works in healthcare, they will see that every now and then, there is change in competencies because they want to try to close the gap once they find one. I don't agree on the frequency of changing competency every 2 years or every 3 years, because I believe you cannot really see the result unless you practice it for some time, but this is not our subject today. And lastly is patient safety, ensuring that patients have a safe experience in getting the treatment needed without any errors from healthcare providers. Now we come to AI in simulation practice. So now we know simulation, now we know the healthcare 6 aims or initiatives. So what did AI added? AI simulation significantly impacts healthcare training by creating highly realistic virtual environment where healthcare professions can practice complex procedures, manage patient scenario with diverse complications, and refine their decision-making skills in a safe, controlled setting. This ultimately leads to improved patient care through enhanced competency and confidence, particularly in handling rare and challenging situations. So, excellent. There is benefits from AI when we add it to simulation. Yes. So what are the benefits? That we are having realistic patient interaction because AI can generate lifelike patient responses, including verbal communication, physical symptoms, and reaction to treatment, allowing trainees to practice communication skills and patient assessment in a more natural setting. Amazing. AI mannequins, specifically, they are amazing in covering these points. Adaptive difficulty. AI algorithms can adjust the complexity of the scenario based on the trainee performance, providing tailored challenges and ensuring continuous learning progress. Feedback and evaluation. They can provide immediate feedback on the trainee actions, identifying areas for improvement and allowing for targeted practice. Rare diseases scenario. They can replicate rare medical conditions that might not be readily encountered in clinical practice, enabling healthcare providers to be prepared for a broader range of patient presentation. Interprofessional training. AI, again, they can facilitate collaborative training scenarios involving different healthcare disciplines, enhancing teamwork and communication skills. Cost-effective training. A lot of you will say, yeah, what? Cost-effective? Yes. Compared to real patient scenarios, AI simulation can be more cost-effective by allowing for repeated practice with diverse scenarios without the need to actual patients. So, example of AI simulation applications in healthcare, there is the surgical training. And since before we jump in here, I have to mention, we mentioned all types of simulation, starting with the standardized patient and more. Well, there are so many studies that have proved that hybrid use of simulation is the best for learning experience for the student. And what I mean by hybrid is using two things together. So if I used AI and a mannequin, or if I used a standardized patient and a trainer, and there are scenarios where using two of them adds more realism to the scenario and enhances the student learning experience. So surgical training mostly use hybrid. So they practice, yes, they enhance their practice. Emergency medicine training specifically, responding to simulated medical emergency with dynamic patients, conditions requiring rapid decision-making. Clinical decision support, utilizing AI to guide trainees through diagnostic pathway based on patient data and presenting symptoms. And lastly, communication skills development, practicing patients' interaction with AI-generated virtual patients to improve communication techniques and empathy. Is there challenges? Always there is challenges. When it comes to AI, the challenges are different. We have data quality. AI simulator effectiveness relies heavily on high quality training data to generate realistic scenarios. The other point is ethical concerns. We are in healthcare, so ensuring that the AI simulations are used responsibly and not perpetual biases. Accessibility, ensuring all healthcare professionals can have access to quality AI simulator trainings. And privacy, which is very important. As a healthcare, we are always following HIPAA and FRIPA, so we have to follow the guidelines and to make sure that we are doing the proper thing. Now we come to Husson AI practice, and we are very lucky that Husson is always looking forward to give the students the best experience or educational experience. So in Husson, we have had some of you might have seen it through the social media. HAL is a mannequin used for training. It provides highly realistic simulation of a patient, allowing medical profession to practice procedures and assess condition in a safe environment with advanced AI capabilities that can respond dramatically to different treatments and scenarios, essentially mimicking real-life patient interaction while enabling them to learn from mistakes without risking a real patient. This is particularly valuable for practicing complex medical situations, as we said, specifically HAL, he imitates stroke, heart attacks, and other emergencies which quick decision-making is crucial. HAL features, as it's not so different than the AI generally speaking, but HAL advanced AI capabilities. He can respond to questions, follow voice commands, and even exhibit realistic symptoms based on a simulated medical scenario, making the training experience more immersive. He possesses a lifelike patient interaction, so the mannequin can mimic facial expressions, movements, and vital signs to closely resemble a real patient, allowing trainees to practice communication and assessment skills. HAL can do diverse scenarios. The instructor can program HAL to simulate a wide range of medical conditions, allowing trainees to practice various procedures and treatments across different patient situations. Safe learning environment, which one of the major pillars of simulation to create a safe learning environment for every student to do mistakes and learn from their mistakes repeatedly. Team training, HAL can be used to train entire healthcare team, allowing them to practice coordinate responses and to complex medical situations. So generally speaking, aside from HAL, AI has an impact on student learning, whether it's a mannequin or a platform. And we don't want to say that AI is only mannequins. No, there are so many healthcare platforms right now, and we will come to this later. So AI in student learning, they personalize the learning according to the strength and weakness of the students, so they can really adjust. They give instant feedback, can provide immediate feedback on assignments and questions, allowing students to quickly correct mistakes and understand concepts better. Adaptive learning, AI algorithm can adjust the difficulty level and pace of learning based on the students' progress, ensuring they are always challenged appropriately. And target intervention, by analyzing student data, AI can identify areas where students are struggling and provide target support through additional practice or explanation. Moreover, they increase engagement. Interactive AI feature like chatbot can virtual tutor can keep students actively engaged in the learning process. Accessibility, AI tools can provide learning support for the students with diverse learning needs, making education more accessible. Data insights for teacher, AI can analyze large database to provide teachers with valuable insights into student performance, allowing them to tailor their teaching strategies accordingly. And time saving for teachers. AI can automate repetitive tasks such as grading and lesson planning, and freeing up teachers to focus on individual student needs. And this slide, it's more about the platform rather than HAL. And here in Husson, we have multiple platforms that the educators use or faculty use, plus the AI mannequin we have. We'll start now. I want you to see this video.
Hi, Hal. My name's Lexi. I'm going to be your nurse today. How are you feeling?
I'm experiencing chronic headaches and I've been feeling fatigued.
Oh no! Could you rate your headache on a scale of 0 to 10?
I would rate my headache as a 7.
Okay, how long has that pain been going on?
The head pain started about a day ago. Resting helps relieve the head pain.
Okay. Can you turn your head to the left? Thank you.
Is there anything else you would like to know?
I don't think so. I'm just going to take a listen to your heart and lungs now.
Okay, go ahead.
All right, Hal. I just took a listen to your heart and lungs and checked your blood pressure, and they all look good.
That's great to hear. Thank you for the update. I appreciate it. Is there anything else you need to check or discuss?
Well, I have some Tylenol I could give you for your headache if you would like.
I actually take acetaminophen for my head pain, so I don't need any Tylenol right now. Thank you.
Okay. Do you have any family coming to visit you today?
No, I don't have any family coming to visit today.
Okay, so maybe we'll try keeping the room dark and quiet and see if that helps your headache.
That sounds like a good plan. Thank you for your help.
You're welcome. Does anything else help with your headaches?
Resting helps relieve my headaches. That's about it.
Okay, so we'll try letting you get some rest. Do you have any hobbies?
Yes, I enjoy hiking and reading. They help me relax and unwind.
Okay, so maybe we can let you get some rest and you can try some reading, especially since the weather's not too good for hiking, and this will help you pass the time while you're in the hospital.
Thank you, I appreciate the suggestion. I'll consider doing some reading to pass the time. Thank you.
Yes, well, I'm gonna go check on my other patients, but you let me know if you need anything.
In Husson, in the Simulation Education Center, plus the communication, AI communication that we have. So conclusion, overall AI simulation has the potential to revolutionize healthcare education by providing a highly immersive and interactive learning environment. This would lead to improved patient care through better prepared and skilled healthcare providers and therefore patient safety. And by this, we are dealing with one of the 6 aims, and we're pushing forward the healthcare system to a better place. There is a quote that I would like to share with you, if I can see it, because I can't really see it. It is by Benjamin, and the quote says, teach me, I may remember, involve me, I learn, and it emphasizes on the active engagement and participation in the learning process. Thank you so much. This is my presentation. I have a question that I want to leave for everyone to feel free to answer me. There is nowadays a ton of AI platforms in the healthcare in order to help the healthcare simulation. And these AI platforms, my question is, are they regulated? Is there someone who really looks into how these platforms are designed and how they are done? And will they help in improving healthcare system, and will they add something? This is something we really have to think about, and I would love to have an answer, because this is the future and it's growing like crazy, and I don't really even know if these platforms have any standards. Thank you so much. I thank you for having me, and I hope I have helped you to understand the whole healthcare simulation era.
Well, thank you so much, Ghada, for a very interesting and insightful presentation. We do have several questions in Q&A. All right, so here's the first question. Do you think there is a gap in optimizing clinical trials protocols and performing predictive modeling of patient recruitment in trial sites to improve clinical trial outcomes? Please provide your insights regarding it. I think the question is asking about the gap. So in between, okay, so we need to optimize clinical trial protocols. On the other hand, we need to recruit patients for those trials. Is there a gap? What do you think, Ghada?
So can you say again the question? Sorry.
The question was about possibly a gap between the need to optimize clinical trials
Mm-hmm.
and recruit patients for those trials.
Yes. Yes, I know it's always difficult because there is so many regulations when we come to patients and when we come to students, having patients in the picture or students. Although it is very hard and it is challenging, but I think if we follow the guidelines and if we follow the regulations, it can be done. Maybe that's why we don't have so many clinical researchers because of this point.
In fact,
Simulation can though solve this problem if we use simulation in researches, and if the simulation session is done to mimic realism in every possible way, because there are so many tools that we use in order to make sure that realism is there, it can cross this gap definitely.
AI can help with both of those, can help to optimize clinical trial protocols because it can absorb and process a lot of data, and it can, as that's what it does, its specialty is optimization, especially if it's properly fine-tuned on its own domain, and it can also help with the other side of this issue. Who do you recruit, right? What patients? It can look at various markers and help you recruit the patients who are more likely to, say, complete the trial. So excellent question. Well, thank you, Ghada. Second question, could you please talk about examples of using AI in simulation for midwifery students?
Okay, so midwife students definitely, because we have a simulator which give birth completely, and there is now AI simulator who can give birth. So giving birth to the baby, placenta, going all through the stages of delivery. So definitely it can be used, and not only normal delivery, but we can do different abnormal deliveries like breech or shoulder deliveries. So simulation and AI definitely is a very good source, especially when there is a rare patients, real patients giving delivery in the hospitals, and we have the clinical practice, we have to cover it.
Thank you. Can you provide a link to the video of Hal in action interacting with a nurse? Could we perhaps do this later? So I think people want to see the entire thing with
Yes,
the
I am
sound.
very sorry. I am alone and I don't know what happened, why the voice, but if this is recorded, maybe I will get you the video by itself and you can disseminate it to everybody.
Yes, that would be awesome. Thank you, Ghada.
Yeah.
Okay, who manufactures the HAL mannequin? Is it commercially available?
Yes, it is commercially available, and Walmart is the vendor. They are the ones who came up with HAL. They have a HAL pediatric, like a child mannequin. So now they made the AI feature in this HAL as well. And they are growing dramatically using this mannequin.
Right. So there was another question about other studies on using AI for the debriefing after a team simulation scenario. I typed in a link for one such study. If you have any further insights, Ghada, please share.
Yeah, so debriefing, again, as I said in my presentation, simulation, it's two pieces, the mannequin piece and the educational piece. The debriefing lies with the educational piece. There is ways to debrief, and there are schools to debrief. AI can debrief, yes. Maybe if I give the AI which debriefing model I'm going to use, but definitely the human effect has to be there, because I cannot leave the student just to the AI. I have to have an educator who understands the objectives of the scenario, and she knows what to tackle and what not to tackle, which skill they need to be really understand more, so that she goes over it again with them. So yes, practically speaking, but I cannot rely 100% on this yet.
All right, any other questions? Please type them in. So I don't see any more questions. Yes, there's some comments. Very interesting. Thank you. Oh, thank you. Yes. Uh-huh. Well, if you found this presentation interesting, this topic exciting, well, guess what? We'll dive even deeper into the transformational power of AI, its impact and risks associated with it at the second annual Maine AI conference. This is a one-day event on Friday, June 13th at the University of Maine campus in Orono. It's going to be a fantastic day filled with insights from academia, industry, and government. Plenty of time to connect and network. And if you're joining us from outside, from out of state, just think about this. It's Maine in June. It's beautiful weather. It's great company, cutting edge AI discussion. You want to do this. What's not to love, right? So the early bird registration is open right now, and should be a link to register. Basically, if you go to the same website where you registered for this webinar, you should see a link to register for the conference there. So again, June 13th, Friday, UMaine, Orono. Okay, let me see if there are any more questions.